Hey guys, welcome back to my channel. My name is Maria Ingalla and I'm a psychiatric nurse practitioner. I break down mental health information about medications and diagnoses into things that you can actually understand versus being in your doctor's office and being like, what? So today I'm going to talk about an offbeat option, which is one of my favorite things to do is explore alternatives to, the typical things that we might see. And this is Doxazosin. So you may have heard of Prazosin, which is a medication that's often used for nightmares and PTSD. What we don't often see in typical practice is Doxazosin. And I actually like it a little bit better clinically. So let's talk about it. So let's talk about Doxazosin and how it works. Around the 1980s, it was developed as a treatment for hypertension or high blood pressure. This was FDA approved for hypertension or blood pressure being too high around 1990. This is a medication that's called an alpha-1 adrenergic receptor antagonist, or like a blocker, if you think of that. So it goes in and it blocks alpha-1 receptors. For hypertension or for blood pressure, it goes ahead and it works on your blood vessels to prevent them from being overactive, right? To relax them a little bit. But when we're thinking about PTSD or we're thinking about other different usages of this in psychiatry, we're thinking about what's it doing in the brain, right? So it works on something called the prefrontal cortex. This is responsible in the brain for attention and memory and focus. It's also something that in PTSD, when you have trauma, or even CPTSD, anything like that, it becomes overactive and it becomes very hard to focus because of that, because you're just super like hypervigilant and you're always looking for a threat and you're also really anxious all the time. You just can't determine if what's going on right now is a normal event or if you're in danger. So it's really critical for that. And Doxazosin works magic for some people to help calm that down. So what it does is it goes in and it blocks alpha-1 receptors. So if you could kind of think of like a soccer goalie is how I like to teach this to nursing students. So you have the goal, which is the receptor, and then you have the ball, which in this case would be norepinephrine, the neurotransmitter, and then he's coming in to get to the goal, and then all of a sudden Doxazosin comes in and he's like, no, block, and he can't get to it anymore. If it can't get into the goal, then it doesn't activate into the effect that it's supposed to have. When it's activated, alpha-1 receptors end up causing things like irritability or being easily startled or trouble sleeping or flashbacks. So when it happens and when that ends up being blocked, we actually see like a huge effect in calming the brain down. So let's look at the benefits and the side effects. As far as the side effects, I'll go over that first because I feel like that's always kind of like the question of the day. The most common thing we see is dizziness or low blood pressure, being that it is a medication that's designed to lower your blood pressure. This does make sense. To prevent this from being problematic for people, usually what we do is we just start at like the lowest dose and we'll go up very slowly to make sure that they're not having like significant problems. We also do a lot of education around, stand up slowly, make sure you're having enough water, make sure that you're not just like jumping out of bed because then you could fall, especially if you get really dizzy. Something called orthostatic hypotension could happen, which means that when you get up, you feel kind of like the blood drop from your head and you feel like you're just going to pass out. So that would be something we want to avoid. Also, things that might happen like tiredness, fatigue. Sometimes people say they get headaches, especially in the morning, and it can cause more vivid dreams. So while it's taking away nightmares, it can also just cause you to have more other random vivid dreams. And then as far as benefits, I talked a little bit about kind of like what it does. So the effect of it blocking those receptors means that your brain is more calm. It means that you have better emotional regulation. It helps with cognitive control and feeling like less anxious and less like startled. So, some people who have PTSD, if they are touched from the behind, they might have like that startle reflex and jump, right? If they don't know that person's there, or even if they do know that person's there, the brain just makes them jump. So it can cut that down so it's not as intense anymore. It can cut down like your intrusive thoughts during the day. It can stop nightmares at night, especially related to trauma. So I really love it for a lot of those reasons. And what I really like about it is the fact that like you take it once at night and it still works throughout the day. Prazosin is kind of like its weird little brother that's like much more well known. Prazosin is something that I often would hear feedback about, like, okay, I took my medication for my nightmares last night and I was okay, but then I woke up around like 4 a.m. and I started having, nightmares again and I woke up really anxious. So Prazosin has a really short half-life, meaning it's kind of like in and out of your body pretty quick. Doxazosin is something that builds up in your bloodstream, and after like a week, it reaches a steady state and it just keeps on working. So it's working for the daytime, it's working for the nighttime, it's lasting you the whole night, so you're actually able to like sleep without waking up with nightmares. So for those reasons, I really like it. It takes about like a week to get over like the initial hump of side effects if you're having headaches or anything like that, but some people don't get over it, and it's just, you know, something they have to end up switching medications. But it's a really fantastic option for people who have PTSD, in my opinion. So, summary. Doxazosin is a really great medication for some people. And if you have ever tried Prazosin, but it was either like too much for you and you felt like, you know, you just felt too fatigued or too dizzy on it, Doxazosin sometimes could be a little bit less intense on that. And it can also just help with kind of keeping things more steady throughout the day versus only working for a small portion of the night. So definitely worth talking to your provider about if these are things you struggle with. And if you want to learn more about different offbeat medication options and different off-label things and all of the things about medication, subscribe, click like, leave a comment if you have any questions, and I'll see you guys in the next video. Thank you.